Hello, hello, everyone. Welcome. My name is Jason Langley. I'll be your host for today's webinar. We really appreciate you guys taking the time to join us today. We're just going to wait for a few more folks to join for the next few minutes. But while we're waiting, we wanted to take a poll about everyone's drug and alcohol testing policies and programs. Hopefully, you can see that popping up pretty soon. Really, this is going to help us steer the conversation and talk a little bit more directly to some of the experiences and situations that some of you were in. We can talk a little bit more about if more people are doing in-house or if more people are doing third party. We can bring that up during our Q&A session a little bit more at the end there. So the first question here is, do you have a drug and alcohol policy in place? Um, and then the next question is multiple choice, is how are you testing? In-house, third party, mix of both, and um, not testing. Wonderful. So, kind of to give everyone a brief overview of what they can expect today, over the next 45 to 60-ish minutes, we're going to be walking through a structured framework for introducing drug testing thoughtfully, legally, and effectively in your organizations. So this session is designed specifically for HR and people leaders who are, either introducing drug testing for the first time or perhaps reviewing your approach. We're going to focus on the decisions that matter the most before testing begins. Some of those decisions include things like stakeholder engagement, policy design, manager education, and employee communication. Um, we also will be exploring how to balance safety and compliance with employee trust, particularly when handling some sensitive data. And I'll be talking about GDPR a little bit later. I think we have quite a few people here. We can get going, and I'll introduce our two lovely speakers today. So today we have two excellent speakers. We have Phil Crawford, Port Operations, Planning, and Safety Management Specialist at Precision Stevedores. Phil brings an extensive background and experience working with organizations in high risk and safety critical port environments, overseeing operations across multiple sites and multiple shifts. We're also joined by Terry Elvin, the head of UK sales at Intelligent Fingerprinting. Today, Terry's going to provide us some practical insights into how fingerprint drug testing fits into modern workplace policies and operational environments. So, together, we're going to guide you through the key considerations, highlights, common pitfalls, and answer any of your questions. So, the goal of today's session is to give you a clear and structured approach to implementing workplace drug testing that supports safety, protects employee rights, and stands up to legal scrutiny. So, with that, here's a quick agenda. Here's a quick overview of our agenda for today. We're going to begin by examining some common challenges that many of you might be facing when creating and implementing a drug and alcohol policy. Next, we'll move on to outlining the framework that HR professionals should be aware of when introducing a workplace drug testing program. After that, we'll look at some different drug testing methods and see where they fit within a strong policy. And then finally, we'll wrap up with a Q&A session where we'll answer all of your questions. Also, a little bit of housekeeping before we start. This session is being recorded, and we'll make sure to share the link with all of you afterwards. Feel free to submit all of your questions in that Q&A box throughout the session. We will address as many as we can during that Q&A segment. However, if we don't get around to your question, please don't worry. I promise you, we'll be looking at all of the questions, and if we don't get to chatting to someone today, or if we don't get to talking about your question today, we will be reaching out and getting an answer to you. Perfect. And with that, Let's start with some of our common challenges that many of you on this call have probably encountered. When HR teams begin introducing a drug and alcohol policy, a few challenges tend to come up. The first one is safety versus trust. On one hand, organizations have a clear duty to ensure employees are fit for duty, particularly in safety critical environments. On the other hand, though, introducing testing can raise concerns about privacy and how employees are being treated. If this is handled poorly, I'm sure it can feel a little bit intrusive. If it's handled well, though, it can, become part of a broader commitment to protecting everyone on site. And I'm sure that Terry has seen that before, and he'll be able to talk about that later. Building off of that, second challenge we have is compliance versus culture. It's relatively straightforward to just write a policy, right? But writing one that meets legal requirements and embedding that policy into the organization's culture, that's that that's a challenge. Clear communication, I think, is at the center of it. I'm sure that Phil is going to talk a lot more about that. The third is prevention versus punishment. There's often this perception about drug testing is, oh, we're catching people out. The reality is, the most effective programs are the ones that are preventative. I think that both Terry and Phil can agree on that, right?
100%.
The reality is, if you're catching people, the business has already been exposed to some level of risk. Um, Finally, we're going to talk about frequency versus operational pressure. So, in theory, well, the safest thing for us to do would be to test every single person as they came in, right? Before anyone touched any piece of equipment, having them do some kind of drug test, but that's ridiculous, right? We have to think about, shifts. We have to think about operational realities. We have to think about time constraints. Many of us work on multiple sites. And I think that something that we've seen time and time again is if testing disrupts operations or create delays, it quickly becomes difficult to sustain, and some people, kind of avoid doing it. Anyways, together though, these are kind of the tensions that I'm sure a lot of you are feeling, and we want to help figure this all out and figure out how to shape what a successful policy looks like. With that, I'll throw this over to Phil, and he can start to talk about the framework for introducing workplace drug testing and building out a drug and alcohol policy. Phil?
Okay. Yeah. So what we need to do is first of all, figure out what the purpose of the drug testing is in the first place. So we can do that by start to ask the question, what risks are we trying to manage? Every workplace is different, and as such, the risks can definitely vary. So in safety critical environments, which I'm from that in the port background, so I certainly work with heavy plant and equipment, cranes, forklifts, heavy industry, impairment can have serious consequences. But even in non-safety critical roles, risks of poor decision making and reduced performance can also exist in them as well. What we want to do is try and encourage safety over a police lifestyle. I think you've already touched on that briefly. When we're implementing a drug screening program, it can be very useful to support the aims and objectives of the organisation. But there needs to be clear boundaries. And whilst we can try and influence positive behaviour, ultimately we, as the employers, are not here to control what staff do outside of work. The main focus of the testing should be on fitness for work, safety of the individual, and of others who may be affected by the impairment. So in terms of defining the scope, so having a clearly defined policy which states when and how testing will be done should be reflective of the risks and objectives for the organisation. So each organisation may approach this in a slightly different way. And so some of the typical ones are things like pre-employment testing. So this is done prior to commencement of employment, usually when a conditional job offer has been made. And it's something we do with all our staff when we take on staff within our industry again to try and reduce the risk to ourselves and other people. So it can certainly improve workplace safety, promotes a drug-free culture, and it can act as a deterrent as well. So people who may be users or people who may be a risk to the business no longer apply, and it kind of acts as a bit of another layer. It can also help comply with safety regulations and help protect the business against any potential legal liabilities as well. It may also reduce costs by reducing risk of high staff turnover, absenteeism, and potential legal fees from accidents or incidents that do take place. Random testing. So this is the cross section of staff tested, which can be done at pretty much any time, but it must be truly random, with everybody having an equal chance of selection. There can't be any bias or targeting, and so there has to be a clear demonstration that it is completely unbiased. It helps to remind staff and reinforce the drug policy, so it keeps them involved. It also improves confidence that staff are not impaired, especially in high-risk areas. Again, the industry I'm in, it needs to have that confidence that people aren't impaired. However, if you overuse, it can negatively impact trust and morale, so it has to be used in the right approach. So random testing is something we use quite often in my business. We usually test around about 5% of our staff each month. We have about 80, 85 staff, so that's 3-4 people every month. And we can vary that and upscale that should we need to. For cause and post-incident testing, so this is typically done when there may be suspected drug use. So, for example, after an incident, or if smell of cannabis, for example, or even erratic behaviour, there could all be signs of some kind of drug use. So it allows for better understanding as to whether drugs were a factor in an incident. So you can rule that out. If the test comes back negative, we can then say that that wasn't a factor in the investigation. Therefore, we can look at other causes that may have been a factor. But it can also look at if there's any specific risk to the business as well. There is a need to ensure managers are trained to recognise potential signs of impairment, and also when they do decide to test, that decision is documented carefully. So for legal and regulatory items, so health and safety duties. So whilst there's no legal requirement as such to drug test, it does allow businesses to demonstrate compliance with their legal duties to protect employees, contractors, and the general public. So this kind of ties into the Health and Safety at Work Act, Section 2, Section 3 sections to kind of look at how they can look after their employees. There may also be reference to drug testing as part of a risk assessment. So one of the control measures, for example, to reduce the risks may be drug testing. So therefore, this can be part of those health and safety aspects. In terms of employment law fairness, so the drug policy must ensure it doesn't discriminate and is applied consistently. Very, very crucial. We need to take into consideration things such as medication that people may take and dependency as a health issue. There should be a clear support mechanism in place, and disciplinary action shouldn't be automatic, but rather a considered process that is applied only when deemed necessary. So it's not used as a tool. GDPR, so drug testing is classed as highly sensitive data, which needs clear justification and a lawful basis for collecting and processing. So for safety reasons, for example, that's the obvious one. Closely monitor what information is being collected, why, and who has visibility of it. All businesses must comply with the Data Protection Act and UK GDPR, and I think we'll touch on that very shortly. Industrial relations, so for any new policies or procedures to be successful, they do require the buy-in of staff. Working with trade unions and employee reps, outline the reasons and benefits of the testing process. Gain the support and can reduce the risk of grievances, disputes, and loss of trust between the two parties. Culture. So consulting early is really, really important. So engage with employees and staff reps. Gaining and taking on board their views can help reduce resistance to the policy. And again, it's coming back to that buy-in of staff and can help improve the overall quality of the policy. So they can have their input, how it will work for them in practice. So it will have more chance of being successful. So don't rush the implementation process. Ensure it's done in a well thought out manner. Explain what the purpose is to staff. Highlight that safety is a key driver and give real examples to their real workplace risks. they'll want to know what's in it for them. So it's good to outline the benefits that will directly affect them. So what will they get out of doing this testing? Demonstrate proportionality. So outline the reasons why the testing is necessary and ensure the testing method is right, ideally less invasive, and the right option for the business. Dignity and fairness. So ensuring the testing process is respectful, private, and handled in a professional manner. The way the testing is done is fundamental to the success of the process and its acceptance by staff. If staff have a positive experience during the testing process, this will help with engagement and the perception of the policy. So in terms of outlining and reviewing the policy, so have an understanding about when you're going to review the policy. So most businesses will review their policies on an annual basis or at predefined intervals, maybe 2-3 yearly, depending on the risks associated with the business. It's a good opportunity to check it remains relevant to the business, does it still fit for purpose, and it's still effective in its objectives. In addition to periodic reviews, consider review after incidents, legal changes, or any other significant organizational changes. Typically, we've seen before with organizations where the people who signed off on the policy, the MD, whatever it may be, have left the business, and so kind of it needs to then carry that weight and ensure it is still fit for purpose, and the people responsible for it are still there. Review and refine the process. So always seek to improve the effectiveness of the policy and align with good practice. Things change, policies change, good practice changes. So it's important to keep up to date with what the current good practice looks like. Look at the current effectiveness, gain feedback from staff. Is it working for them? What are their comments? And investigate any unintended consequences. So there may be things that come about because of this testing. Perhaps people are using it in the wrong way, or it's not being applied in the correct manner. So again, understanding why that is the case and trying to deal with those consequences and again, refine the process. Drug testing works best, certainly when it's risk-led, it's fair, and most important, it's transparent. Everybody understands exactly what the process is. Done poorly, it creates legal and cultural problems. However, if it's done well, it supports both safety and reinforces trust.
Perfect. Thank you very much, Phil. Just one question about the outline review. Is there a general rule that someone should maybe look into every year, once every 5 years? Of course, we should be looking at things as policies and laws change and as incidences happen in the workplace. But outside of that, are there any other checkpoints that we should be looking for?
I think annual is always a good point because most people review things like risk assessments on an annual basis. So this can form part of that. And often the risk assessments will be supportive of the policy. Everything stems from the policy, safety policy, drug policy. So I think an annual review is good. And I think certainly when there's any trigger points, again, the law changes or there's been an accident, that's usually a trigger for me. When there's been it depends on the accident if it's relevant to the particular policy. So certainly there's been some issues with drug use impairments within an accident, then review was the policy effective, and then there may not be any changes. It may still work absolutely perfectly fine, but it's good to have that review, check it is still working. And again, things like organizational change is quite important as well. I've seen it many times in organizations where the people responsible for certain aspects of the policy are no longer with the business. So in terms of the recommendations for that, I would always encourage job titles or job roles rather than an individually named person. So therefore, if a managing director leaves the business, it's still the managing director's job to oversee the policy rather than Joe Blogs, for example. So that's kind of my recommendation when you're itemizing who's responsible for certain roles within the policy.
Perfect.
Yeah, Phil,
And
and I also think sorry, Jason, I was just saying, leading back to the legal webinar that we worked with recently, I think it's important to check in that you're on on target to achieve what you disclose in a policy, because it's okay having it in the policy. You need to evidence that you're actually adhering to the policy, and it's not just hearsay. You need physical evidence. If you say you're going to do something and something happens, it's really important that you can evidence that you've been doing what you've said you were going to do. Otherwise, you are legally exposed.
Absolutely. I
Perfect.
think that review process at the end, that kind of it's a self audit. You're
Yeah,
kind of looking. You said you're going to do so many random tests. You're going to do pre-employment testing. Are you actually doing that? And if not, why not?
yeah.
So yeah, that's definitely a key part of that is the audit at the end, and then again make the adjustments
Make the
should you
adjustments. Yeah.
feel yeah.
And maybe one question, maybe I can throw this to Phil first. You talked about culture and how your policy and your testing method affects how people respond to it, and how having employees buy-in is so important. I can only imagine for HR professionals how difficult getting employee buy-in on something like this is. Can you touch on that and your personal experience on having pushback, on having people adopt things, having people accept, the increase in drug testing?
Yeah, so in my role, it's a two-way street. So I've got to get the engagement from operational managers who don't want any downtime in their operations. They've got pressures, need to get vessel operations and their kind of role done, and also the staff, the frontline staff who want to just get on with the work and don't want to be disrupted as well. Um, so there is kind of trying to make it less invasive. So again, we use many different testing methods, and again, I think you'll come on to that. Historically, urine was a big one, um, but it is time consuming. You do need a certain room, you need certain facility to be able to do that. It's not as easy to do that in an operational area. So the method used now, which is obviously the intelligent fingerprint technology, makes that buy in that cell a lot easier because the downtime disruption is minimal. The staff are aware that they can go to the toilet before they come for a test. A lot of people hold that in. They can see the test being done in real time. We're kind of in the same room doing it across literally, a meter away from each other. They can see us writing everything down. It's very transparent. And the the kind of ease of the test, if you like, the ease of how we do it, very quick, very easy, makes it a lot easier to convince staff that yeah, this is this is good for the business, and it does give that confidence as well. So they understand the reasons we're doing it because 5, 6, 7 years ago we did have a serious problem with people being impaired or certainly drug use. There was very little testing, and again, having a policy, having things in place has not removed it, but certainly reduced it to acceptable levels now that we can now manage that. So I think it's kind of the proof's in the pudding. You've got to get something right. There are some changes in there, and then if you get it right and it works and it's fair, transparent, staff will see what they're what's actually happening, and proves in the pudding. That's kind of what it is with the staff. You can say lots of things. It will be you know all singing, all dancing, but actually until you actually deliver that, then
Yeah,
the buy-in becomes a
it
lot
seems
harder.
like just like what Terry's been saying this whole time. Do what you say you're going to do, right? Do what you say you're going to do.
Absolutely, yeah. You've
Yeah.
got to deliver on your promises. Absolutely.
Well, with that, I can talk a little bit about GDPR here and where drug testing fits into that. So GDPR governs how organizations handle personal data. I'm sure all of us are pretty familiar with that. So in workplace environments, that responsibility becomes pretty significant. Drug test results are classified as special category data. I think Phil mentioned that earlier. So what that means is that they require a higher level of protection than standard personal information. So at its core, GDPR essentially gives individuals control over their personal data and holds organizations accountable to keeping that data private. For employers and for many of us on this call here, that translates into a few key responsibilities. So, number one, you must have a clear legal basis for collecting that data. Number two, you must be transparent about why you are collecting it and how it will be used. Next, you must only collect what's necessary, and you must store it securely with access limited to authorized personnel only. So, when we talk about the context of drug testing, it becomes a little bit complex, of course, because we're dealing with some pretty personal information. So that means that every step from collection to storage to deletion needs to be pretty tightly controlled. I'm sure that many of you can understand that the consequences of getting this wrong are pretty significant. If your organization is found to be in breach of GDPR rules, you can face some fines up to 17 million pounds or 4% of global turnover, whichever one is higher. Uh, that's
Ridiculous.
yeah, that's a pretty enormous bill to face, hey? Also, on top of that, we're talking about reputational damages, loss of employee trust, and some possible legal challenges. A recent example that I found was Capita. They were fined 14 million pounds by the Information Commissioner's Office following a cyber attack. Uh, Basically, what was found was they had people's personal data and they weren't protecting it. Right. And that was a large organization and that was just regular data. Now we're taking, some pretty sensitive data from people. Anyways, in practical terms, what organizations should really focus on are a few actions. So, number one, obtain clear documented consent whenever you're running a test. Two, try and use anonymization, such as donor ID numbers instead of names wherever possible. Three, you should ensure that your systems are secure. Putting things behind lock and key. If any of these files are digital, putting them behind password protection and encryption. Number four, you should define clear retention policies for those results. And most importantly, you should train your team so that they can understand the processes and responsibilities. This only works if we're all on the same page, right? These steps aren't necessarily complex, but as I said, they require consistency across all levels. Um, so with all of those foundations in place, I think now's a pretty good spot to ask Terry to outline some of the different drug testing methods and how they kind of support some of those requirements. So I suppose Terry, to start off, can you tell us about some common themes that you see personally when you're talking to clients about making their drug and alcohol policies?
Yeah, absolutely. Thanks, Jason. Yeah, I think whether it be a small, medium, or large business, we tend to hear sort of five or six common themes, and that will probably resonate with the people on the call. Um, Anything from sort of we trust our staff, so we don't want to test them, which could be legally challenging should something happen. Um, we've got a policy, but we don't really enforce it. We don't test, and we'd like to do something about that. Another key issue is we've got a figure that we've got in our policy. We try to test 10% of our staff, but we struggle to achieve those figures due to operational complexities and challenges with methods and those type of things. Common one and coming more prevalent now is we don't really want to handle other people's bodily fluids, urine, saliva. And also another key one where we know we've got problems out there in society with recreational drug use is we're worried about losing staff. We've got critical contracts. We need our staff. Without those, we're going to struggle to operate. So I hear that day in, day out, as do the team as we consult with businesses.
Perfect. So, what options then are available for organizations? I did this poll earlier. It seems that 80% of us on the call have a policy, 50% are in-house, 9% are third party, 13% are a mix, and some of us are still in that deciding phase
Yeah.
of what options are available. So, can you kind of walk through what all of those mean? Third party, mix, and in-house?
Absolutely, and it's good to see sort of 80% of the call has got a policy in place. Um, so fully outsourcing is basically passing control over to a third party to conduct your complete drug and alcohol testing program, and that works for some businesses, but it does come with its challenges. Normally, you'd have to sign up to probably a 2 or 3 year contract, so you don't get time to see how it's going to work for you as a business, and if it isn't working, it can be tough to get out of that. There's a lot of planning that goes into that. And I'm sure people on the call will know, okay, we've planned to do something, but something else has come up in the business and we can't really do that today. So it's very structured. It's very rigid. People also get to hear that a third party is coming in to do the random drug testing. And then suddenly you find people disappearing from site, calling sick, problems at home, and everybody running for the hills because they know it's about to happen. And there's a large amount of, as I say, infrastructure, POs need to be raised and all of those sort of things to get that moving. But it is a service and it works for some companies. Hybrid is a little bit of a mixture whereby you take it on board that you're going to do your screening in-house. So members of your team will conduct your initial screen of a donor for whatever the reasons that you're going to screen, whether it be pre-employment, random, for cause. But in the event of a flag of a non-negative, it normally means that you have to call that third party to provider, take on the next stage, which is getting your chain of custody in place for confirmation from a laboratory. And that's where some other disruptions come in. Again, you've got to make that call. There's normally a service level agreement of 2 to 3 hours to arrive on site. So then there's downtime of the donor, the supervisor being unproductive for that period of time. And that works really well. Sometimes if you're 9 to 5, but also then operational challenges when you're a 24/7 business. You can't get admin to raise a PO in order to provide the right paperwork. And we hear that is, again, as some of the challenges when you're involving a third party, which is why probably a large proportion of the call here have managed to bring their testing program completely in-house. Now, the benefits of that are you have complete operational control over your business. You can test for all the reasons that Phil mentioned earlier, but you can do it in a efficient, cost-effective way. And it normally involves just training some staff, certificating some staff within the business to control that drug and alcohol program. And it also enables you to react as you see fit without those other barriers of involving a third party.
Perfect. So it seems like a lot of us are doing in-house. Phil mentioned urine. Can you kind of walk us through, Terry, what options we have for in-house?
Sure. Yeah. The thing with drug and alcohol testing, there aren't many options available to professionals and workplace that is acceptable to be applied in the workplace. You know, we're not going to necessarily pull out people's hair or inject them to try and analyze through blood and hair. So urine is probably the most tried and tested. It was one of the first matrices that came into the arena for drug testing. And with any of the methods that we're talking about, whether it be urine, saliva, or sweat, we all do exactly the same thing. We use lateral flow technology, and we've got levels of accuracy of screen around sort of 95%. So we're all doing exactly the same thing. But the two differentiators are that we're looking at how far we're going to go back into an individual's lifestyle, and what matrix bodily fluid are we going to choose to do that, and they're important considerations. So urine testing will go back into a donor's lifestyle up to sort of 5 days and beyond. So at the point of test, we're casting a look back that far, and that can come with its challenges. It's right for some organizations, but actually there's something Phil mentioned earlier around for cause testing and looking at is consumption or potential impairment an influencer to that incident. Now, if you're going back 5-6 days into a donor's lifestyle and you're detecting a drug present, it's very hard at that point to see whether that consumption has had a direct impact on the incident that's prevailed. So no different if we said, "Oh, we've crashed our car, but I had a drink 5 days ago." We don't know the level of impact that's had. It also comes with its challenges. Phil, you pointed them out really well earlier. You know, we need to toilets, we need to lock off taps, we need gender-specific staff. It's a very different process for any males on this call to females in providing that sample. We do get shy bladders, and it takes operational facilities out of action for that period of testing. And some locations just don't have those facilities available. So then we can move on to sort of saliva as an option. A lot of companies have transitioned from urine into saliva because it is less invasive. But there are some preparations that we need to consider. With saliva testing, we need to administer a nil by mouth process, making sure a donor hasn't consumed any food, smoked, drank within those 15 minutes prior to the test. And when people are put on the spot, just like I am today, I've got a pretty dry mouth. So providing enough saliva can be quite challenging. Chewing on that swab, it's viscous, and then you're having to, get that off of the sponge as such and create enough sample to get a good conclusive test result. And there's some of the challenges there. And as Phil mentioned earlier, much more difficult to witness and easy to adulterate those samples. The main considerations there, it's your window of detection, how far we're going to go back into a donor's lifestyle, and what sample method we're going to choose.
Perfect. So, yeah, urine and saliva, I'm sure everyone is familiar with on here, and quite a few of us are probably familiar with fingerprint sweat drug testing. Could you walk us through that a little bit too?
Sure. We're fortunate. We've had the benefit of those other two products being out there. So when we we knew we had this capability with sweat. It gave us the opportunity to overcome some of the barriers to the organisations face to drug testing. And we've addressed those in many ways. So firstly, it's really easy to get a sample. We take sweat from the fingertips. It's just a 5-second sample on each finger. So it takes a minute to collect a sample. That's consistent, it's scalable. The majority have digits, and in the instance when someone doesn't have has a missing finger, we just test the other finger twice. So we can get a sample really quickly, consistently, which means it's scalable. We don't need to prepare any facilities in the collection process. We can do it pretty much anywhere. We don't need any gender-specific staff. It's a witness test. So again, that removes any suggestion of adulteration with other individuals. We also include a reader with our system. Now, the important element of that is that we're removing, when you're bringing something in-house, a lot of companies don't want the person testing to be testing a colleague. It puts them on the spot. It puts them in a difficult situation. We have a reader that interprets the results that we put onto our cartridge, and it goes into that device. And it's almost the third party in the process. It's impartial. It's a computer says yes, computer says no kind of outcome. It's binary. So the donor and the person conducting the test can say, it's not me giving the result. It's the device. It's the drug expert in the room. The other unique thing with sweat, it's got a narrow window of detection. So with our system, we're looking at a 16 to 24-hour window. So we're actually learning something from that detection window. Firstly, there's great employee buy-in because we're not policing lifestyle. It's a non-invasive, easy to do test, so you again get that buy-in. And equally, if someone has ingested something in the previous 16 to 24 hours, whilst you can't measure impairment, there is a greater suggestion of potential impairment because we've learned when that drug was consumed. So overall, it removes a lot of the problems that companies face when thinking about how are we going to do this, what are we going to do, and what does it really mean for our donors and our business.
Perfect. Thank you so much for those insights, Terry. Well, let's keep the conversation going and let's head to our Q&A. We have a few questions in here already. Feel free to put in any questions burning on your mind. To start off here, I think this is a pretty good transition from what you were just talking about, Terry. One question that I have, how do we decide on the safety value to a non-negative drug test on Monday when consumption may have happened outside of work time?
Yeah, it leads back to method. As we said, we can't measure impairment. So if you're doing Are we saying that actually, if we do a drug test on a Monday, how do we know when that's been consumed? It's very difficult. We're looking at a snapshot in time with any individual, and we're all unique. We metabolize something very differently. Jason, I know you well. You're a big lad. If we went out for a drink, I wouldn't want to keep up. I'm 5'5". If I drink a pint of beer, I consume it very differently to somebody else. It's around weight, size. It's around your individual metabolism, how hydrated you are, and that's the same with anything that we ingest. All I will say is that depending on the method that you choose, it's just determines how far you go back. And all a drug test will do is tell you the presence of a drug at that given time at the point the test was taken. It can't tell you necessarily when it got there, how it got there, or why it got there. It's just there. Um, so it is a challenge for businesses, but all I would say is yes, urine will go back 5 days, saliva will go back sort of circa 3 days, and they're sort of averages from clinical studies in those areas, but everybody's different. So with our test, if you tested somebody on a Monday, it wouldn't pick up something that they consumed on a Friday or a Saturday night.
Perfect. Um, Next question that we have here, I think, Terry, this one might be best for you as well. So, how do we manage CBD oils or CBD drinks? Do these show up in tests?
Um, no. So where the when you smoke cannabis, we're looking for THC, which is the psychoactive element of cannabis. CBD is not present in our test. Now, if you're getting CBD oils from a reputable source, there is a controlled percentage that is allowed in anything that's retailed in the UK. However, if someone's getting CBD oil from a non-reputable source and it has a higher THC content that they may not know about, there is the potential that it could pick up on our test, but it would pick up the THC element, not the CBD. Um, it's capable of picking up THC. It won't pick up the CBD, but if it's not coming from a reputable source, there could be high levels of THC content in the CBD oil, in which case you would want to know that anyway, and it would flag on any of the matrices that we're talking about, not just ours, any of them.
Perfect. This next one might be a little bit of a difficult one. I'll open the floor to either Terry or Phil. So we're talking about GDPR here. So why should a negative test result be retained? I think that I'll expand that to why should results be retained. The example here is an employee correctly declaring a cancer treatment prescription, but is now concerned that they might not be considered for a future promotion because they've declared their illness, and maybe some of that medication would show up in some kind of drug test. So HR retaining current prescription data seems like a current GDPR breach. I know that that's something that we've talked about a little bit before, about declaring what prescription medication that you're on to your organization. Terry or Phil, are either one of you comfortable talking about this?
I think in terms of the negative tests, so we still keep them for um, probably for a few days afterwards securely. There may be some claims about, in terms of not being offered a position, which is why we make sure that the drug testing is at the last stage. So it's not done before. It's kind of everything else is subject to that. We have had people in the past who have, probably not so long ago, to be fair, who had been cancer treatment and went through the process. They didn't fail the test. The test was fine, to be fair. Um, but we're looking for that illicit drug. So again, you can elaborate more than that. But in terms of, I think a lot of the treatments we have, they're normally regulated and kind of not illicit as such. So I'd be very surprised. And we have had a cancer, someone who was in remission as well, who had successfully gone through the process, and we supported them back into work with that. So there was no issues with the drug test when we did that in that similar type scenario. But again, in terms of retention, we would normally destroy people who did fail the test, who didn't. Part of the pre-employment side of things, we would definitely destroy at that stage. How do we keep things afterwards for any potential, tribunals or anything of that may arise from dismissal. So only if they're employed with us would we keep it. If it was pre-employment, we would destroy that.
Yeah, I think Phil's been best placed to answer that question. We do have a mixture of companies that will only ask for declared medication after a non-negative result. Are there any medications that you're on that could have contributed to this outcome of this result? But as Phil said, that's going to be then illicit drugs, not specific medication. And I think most people's policies, if we go back to sort of the company policy, is that if you are taking any medication that could potentially impair or for driving machinery, as codeine, it says on the box, most companies' policies are that you do actually need to declare that to your line manager anyway, so that they can do risk assessments as to whether you're fit and appropriate to do the role, and maybe move on to other roles that might be put the company and yourself at less risk whilst you're going through that period of taking that medication. So there are a couple of points there, really. I think, Phil, yeah, absolutely. And I'll also mention that our system that we have actually date and timestamps everything that goes into the reader in a GDPR compliant way. So long as you're using a donor anonymity, we have the ability to download our results and store them. And the only reason you might want to store from an extended period is if you're audited. If you have an incident, for example, where the health and safety execs are involved and they go, okay, that's why you might need to retain, is because you need to evidence that you're doing what you say you're doing. Our system will be able to do that in a simple CSV file that you can download, date, timestamp, and donor identifier that is GDPR compliant. So you could destroy the top forms in terms of that might have declared medication, but still have evidence that you've conducted the testing that you said you were going to.
Excellent. Another question that I have here, surely you would still need to get a sample lab tested if you've had a non-negative result from the reader. Terry, can you talk a little bit about that?
Yeah, absolutely. Whether this goes across the board, really, whether you're using urine, saliva, or sweat, 95% accurate. We say non-negative because it's a presumptive positive. There is a great suggestion that you could have consumed something, but every one of those processes to be legally compliant, to be able to take action as an employer, requires an evidential standard from a UCAS accredited laboratory that will legally defend that result. So we have that service from a UCAS accredited lab, just like all the other providers and matrices. It goes hand in hand. And yeah, I completely agree. That's exactly what you need. I always refer the fact to COVID. We did a COVID test and you saw that line and we waited for the result. But then we had to book a PCR appointment, didn't we, to go and drive somewhere and give another sample and get a PCR result. And they don't always align. There is a potential that at the time you did the test, you had COVID, but by the time you've looked at the results, it's an inconclusive result or you haven't got COVID. So, and that's lateral flow technology. That's what you have to do.
Perfect. Thank you guys very much for your insights, and thank you everyone for the questions. With that, we want to thank you all for joining us today. Really, really special thanks to Phil and Terry for sharing all of your insights. Just, before we close, some key takeaways to keep in mind for everyone. Start by evaluating your current policy if you have one. It should really always guide your approach to drug testing. From there, you should ensure that the testing method really supports that policy, that it holds it up. Finally, we would really encourage everyone to consider fingerprint drug testing and see how it can really modernize your program, help create safer, less invasive, and more efficient workplaces. Thank you again for being a part of today's session, everyone. We really look forward to continuing these conversations, continuing these webinars. Feel free to reach out if you would like any more information or guidance on your current drug and alcohol policy. If you have any questions, feel free to reach out as well. And please feel free to join our next webinar, The Science Behind Fingerprint Drug Testing. I think that's on July 9th. We'll be sending out invites to all of you. But again, thank you very much, and I hope you have a wonderful rest of the day. Thank you, everyone.